welcome to our knee workshop. And today is going to be hosted by Blair, or he's going to be presenting. So Blair is a passionate physiotherapist. He likes to treat and keep people moving. He has 30 years of experience as being a physiotherapist, and he is the founder and president of Nose Creek Physiotherapy, and it's up for 20 years now. So without further ado, let's pass the stage to Blair.
Awesome. Thanks, Sai. And also want to recognize Chris, who's had a busy day with her daughter graduating. So Chris is one of our staff members as well, who's got a few more years of experience than me. I won't say how many, but we love having Chris to come out to presentations. And we do have another staff member that's probably forgot or got really busy. He's a new member to the team. I was hoping to introduce him as well, but he's Heman Patel. So he's pretty excited to join our team. He's been working there for about a month now. So anyway, without further ado, let's get going on chronic knee pain. So I'm just going to tap our slides ahead here. We do have a bit of an agenda. There we go. And so my goal tonight is just to do a brief review of the anatomy. We'll go through some conditions. We do have 10 listed, so I won't spend a lot of time on them. I'll kind of zip through them pretty quick. I just want to show you that there are a lot of things that can go wrong with the knee. And then we'll have a quick coffee break Q&A.
Uh-huh.
Here we go. Okay, I'm back. Sorry.
Okay.
No problem.
Sorry.
Hey, that's okay. What was I going to say now? Coffee break, yeah, Q&A. So if you have any questions about conditions or anatomy type thing, just pop the questions right in there into the chat box. And the chat box is on the bottom of your toolbar there. You just click on chat and it kind of opens on the right side of your screen and just literally type in and then press enter. So we can maybe answer a few quick questions during our quote unquote virtual coffee break. And then after that, we're going to talk about prevention. How do we prevent knee pain? We're going to actually have a video for some self-stretching that Sai's going to queue up for you because she's our host. And then we also have a testimonial from one of my patients who's actually a nurse in town who came in with a lot of knee pain and was really down and out and quit running because her knees were so bad. And we managed to turn that around. And you'll see in the testimonial, she's actually at that point she participated in a triathlon and she was so excited. And she's not young; she's kind of middle-aged. So I mean, it was a very kind of real thing for her, and she was really excited. That's why she was quite happy to do the testimonial for us. After that, we'll do some draws with Sai. We're going to spin a wheel. Everyone who's registered will be on that wheel, and you get the prize if your name pops up. And then after that, we'll just talk about our offer, how to engage with us, and then we'll do a short sort of Q&A after that as well for any questions that may have come up in the last little while. And my light just turned on in the room, so hopefully my room's not haunted. Anyway. Here we go. Okay, so I'm really proud to be part of a team of physiotherapists that's really passionate about getting clients their amazing results and restoring their function with their aging knees. Our focus is to really focus on you to get your goals back and get you back to what you want to do. All right. And so the knee can be really simple, yet it can be really complex. So there's a lot of moving parts. And so when things are moving, things can go wrong. And sometimes you move too much, you can get into what we call an overuse injury. And then we have the natural mechanical wear and tear that occurs in our aging knees. And then we can also have conditions in the knee that are systemic that can attack the knee and really cause some massive changes as well. So here's the anatomy of our knee. So just looking at the basics, I'll see if you guys can see. Can you guys see my little hand there? This is the femur, and then this is the tibia. So the femur is your thigh bone, and the tibia is kind of like your shin bone. And then we have that little kneecap, or we call the patella in medical terms. And then between those two bones, we have articular cartilage that kind of lines the surface of the bones. And then between that, we have a medial and a lateral meniscus. And the medial and lateral meniscus are like shock absorbing tissue that help actually extend the life of our knees and allow us to do a lot of pivoting and sort of really hard things with our knees. Our knees are actually an amazing joint. And it always amazes me how long our knees last considering the torture we put them through. So what is chronic knee pain? So chronic knee pain is when you're getting pain that's more than sort of, I would say 12 weeks, and you're getting sensitivity in one or both knees. And it's determined by what you're experiencing quite often. And many conditions can contribute to that. And there's many treatments that exist. And so that's why it's important to actually come and see a physiotherapist to get a diagnosis, first of all, and then set up a treatment plan that's going to fix your type of knee pain, because there's different types of knee pain. And yeah, each person's experience with chronic knee pain rather, can be very different. And so, people say, well, what's causing my pain? Again, there's several factors that result in these conditions. And that's why, again, we just said that it's important to seek help and get a professional sort of opinion in regards to what's wrong, get a treatment plan started, and don't just try treating it on your own or medicating it on your own. That's a surefire way to not get better. And physical conditions as well and diseases can cause pain. So, and it's hard to diagnose those yourself. And that's why it's really important to get some medical interventions. So the first condition is osteoarthritis, and that's basically a mechanical wear and tear of the knee. And so on the left side of your screen, there's a healthy knee. On the right side, there's an osteoarthritic knee. And so on the left side, you're going to see nice, smooth articular cartilage here. Okay, and on the right side, you're going to see kind of bumpy and even holes in the articular cartilage. Okay, so the analogy I make with articular cartilage is it's kind of like the linoleum that you put down in your kitchen. When you have a brand new house, it's all shiny and new and looks really good. And then after a few years of wear and tear, you'll start to see, especially in like the stairs area, if you have linoleum and stairs, it starts to lose its shine. It starts to break down. You get like little fibrillations or little hairs coming off that. And that's exactly what happens to articular cartilage over the years. But unfortunately, articular cartilage lasts up to 60 years for the average person. So that's pretty amazing cartilage when you really think about it. And again, we can get pain and swelling and joint destruction kind of as part of that whole osteoarthritis kind of wear and tear process. The other thing is you get systemic diseases, and one of them, there's a whole bunch of them, but I'm just going to touch on one tonight. It's called rheumatoid arthritis. And so it's a chronic disease where the body's immune system mistakenly attacks the joints, causing swelling and pain. You can see that picture up there. That's a picture of somebody with rheumatoid arthritis in their knees. Well, osteoarthritis can strike one knee. Rheumatoid patients will often experience it on both sides. So that's where it's a dead giveaway, especially if they look that puffy. And another dead giveaway is in the morning. It normally takes us, like as we get older, kind of like an hour to kind of loosen up and feel good. With rheumatoid arthritic patients, it can take them like 2 or 3 hours before they feel like they're loosened up and ready to go. So that's another cardinal sign that there may be some what we call chemical things going on. And quite often with rheumatoid arthritis, we see it in the hands, in wrists, and in feet as well. And that can cause a lot of fever and fatigue. So this is the kind of stuff that we need to definitely help with the doctors with medication. And then post-injury arthritis. So the sooner you basically injure your knee in your life, the sooner you're going to get osteoarthritis. So because it speeds up the mechanical wear and tear in your knee. So a lot of athletes that get injured in their 20s are getting knee replacements a lot earlier than the average person that maybe wasn't a professional athlete in their younger years. So that's basically what happens there. And again, that just accelerates the wear and tear in the knee. The anterior cruciate ligament is basically a ligament that stops the tibia, the shin bone, from going forwards on the femur, the thigh bone. And so you often hear this one in the sports world, like in hockey, maybe with the NHL playoffs on right now, or soccer, football, or basketball. Typically, the mechanism is the person will kind of be bending and twisting, and the knee sort of bends and they're lunging, and then they usually get hit or they slip and fall. It has to be like a full body weight sort of scenario where they're pushing. For most ACL patients that I've treated in the past, it usually takes 3 insults to the ligament before it finally does rupture. And we'll talk about the different grades in a few minutes here. But that's basically what happens there. You get swelling, the knee hurts and it becomes unstable. Like the patients often describe it feels like my knee gives out of me now, for no reason. That's because the ligament is no longer there to hold that bone from sliding forwards. We can also have tearing within the ligaments, and ligaments basically connect bones to bone, okay? And then tendons connect muscle to bone, and we can have trouble with tendons as well, and that's what we call tendinitis. So tendon and then itis. So tendon is the anatomy and itis is the swelling. So that's how that works, just so people can understand it. And then symptoms, again, you're going to get symptoms right where the tendon is and where it attaches to the bone, and the pain usually gets worse with movement when you've got tendon issues. and you'll sometimes get cracking and crepitus. You'll often feel some swelling, some localized heat, some redness. You may get a lump develop in the tendon. That's really obvious when you get Achilles tendonitis. You'll feel a lump and you'll see a lump in the tendon. And then if it's not treated, it eventually just tears and you can get a rupture. So that's why it's important to seek help to prevent any further tearing or rupturing of that tendon, any tendon in your body. And so tendinosis versus tendinitis. So tendinosis and tendinitis are often referred to when we're talking about tendon problems, and they're often confused by one another. And I was fortunate to meet Karim Khan, and he's the guy that actually came up with the name tendinosis. So he invented that name a few years back. And so what tendinosis is the degenerative changes in the tendon tissue where we get mechanical breaking down of the tissue, and it's usually kind of in a more chronic situation. And it really occurs from 3 weeks to 3 months. For it to be repairing itself if you're given the correct loading exercises. So with the Achilles tendon, they did a lot of research with Karim and his groups, and there's 6 other groups around the world that validated what we call heel drops. And the heel drop basically loads the tendon and actually causes the tendon to physically rebuild itself. So that was kind of groundbreaking for us as physiotherapists to really find us a long-term solution. Because when I graduated 30 years ago, we just would ultrasound, do local modalities, get people stretching. Everyone felt better, within 6 sessions, and away they go, and then come back 3 months later saying it still hurts and it's come back again. Why has it come back again? And that's because we didn't load the tendon. And so now within that once you're through that inflammatory phase, we like to load the tendon to get it to rebuild itself. And I actually do heel drops as a bit of a maintenance as part of my fitness routine now. And so tendinitis is basically the first stage of that whole thing where you do have an injury, and it's really the first 2 to 3 weeks of the injury. That's when medication and things like that can help. But after 3 weeks, like Karim Khan was teaching everyone around the world, that after 3 weeks, the chemical treatments are not going to help the tendon. It needs mechanical stimulation. And again, doctors can differentiate between these two by scanning with ultrasound or MRI scans. And ultrasounds are a lot more common now. So if your doctor's worried about any tendon pathology, they'll often send you to the radiology clinic to get an ultrasound done to confirm exactly kind of where that stage of wear and tear is at. Recovery time. So tendons take a long time to heal because the blood flow of tendon is typically quite low. Muscles get tons of blood flow, and that's why muscles tend to recover within 6 to 8 weeks. Tendons are basically double that in most cases. So tendinosis can take 3 to 6 months to heal, and physical treatments or physical therapy treatments rather can definitely speed that up and give the person a better optimal outcome. And if the person has the tendinitis with no degenerative changes, they just have a kind of a swollen tendon. If we catch it early enough, it can be like 6 to 12 weeks. Another injury we see is on the outside of the knee. So this is kind of on the outside of the knee. And this is called the IT band. So it's a ligament that runs down the outside of your thigh, and it can rub on the bone on the outside, and that creates irritation and swelling. And we see this quite often in runners and people that love cycling, especially through the spring, summer, and fall. And this condition is successfully treated by physiotherapy because it's just simply a muscle imbalance. And so as long as the people do the prescribed exercise program, they do really well. So that's really the secret to that one. And then runner's knee, or patellofemoral pain, we'll often call it kind of in the clinic as physios, is pain around the front of the knee, and typically it's under the kneecap or around the kneecap. And sometimes the sports med docs will call it moviegoer's knee, because if you sit with your knee bent for more than 2 to 3 hours, your knee will really start to ache. That's one advantage of having cruise control in your vehicle. If you're driving, you can kind of move your knee around a little bit while the cruise control's on. That's what I have to do now. But you'll get lots of popping and cracking with patellofemoral, and people often worry about that. And what that is misalignment between the hip and ankle, and a lot of weak muscles in between. And that can cause excessive wear and tear of the articular cartilage in the back of the kneecap if not corrected. And I used to work at UFC where we had knee rounds and we showed x-rays, what we call skyline views, where they take a picture of the knee bent at 90 degrees and they take a picture underneath the kneecap. And we'd see some people literally with the whole side of the kneecap just sheared right down, and almost have like an arthritic osteoarthrosis happening on the outside underneath the kneecap. So it can get really bad if it's not corrected. And then meniscus injuries, and that's that cartilage tissue inside the knee. We can damage that, and that's often damaged in the same time as when we tear those ACLs, because we have a full weight-bearing twist of the knee, and that's how we twist those meniscus tissues. We've got a guy in the clinic right now who's one of my favorite patients. He's a Coca-Cola sort of service guy. And he slipped and fell like a year and a half ago and went down and knees twisted, full body weight. And we knew right away he had a meniscal issue, but it took us a long time to finally get him to the right surgeon who identified it and did the proper surgery. And so now he's just in recovery. But yeah, so that's an example of how it can really limit your function. So it's basically rubbery cartilage that acts like cushion between the two bones, your thigh bone and your shin bone. And it's very susceptible to tears. And it gets worse as we get older, actually. You are more susceptible because we get what we call fraying tears within the edge, the inner edge of the meniscus. And it can cause a lot of stiffness and swelling in the knee. And often people have trouble locking their knee because it's jamming. Medial collateral ligament is on the inside of your knee. Basically, it runs from your thigh bone to your shin bone, and it helps hold and give you side-to-side stability. And when you have a tear of that one, it's usually from a bad fall again, or being hit from the outside, your knee kind of buckles inward. There's different types of medial collateral ligament injuries. And so there's first degree, which is the least severe, which means the ligament has been irritated but not physically torn. Second degree, there's a partial tear of the tissue, which can cause some instability and looseness, a looser feeling in the knee. And then there's third degree, where there's a complete rupture. And so I do have a piece of paper here. Where did I put it now? I was going to do a quick demonstration here. Let me just grab another one. So those of you, if you want to follow along with this demonstration, just take a piece of paper out of your photocopier or printer, and then take the piece of paper and then just scrunch it up, okay? So you scrunch it up like this, okay? And then I want you to unfold it back to its normal size. And it's all kind of bumpy and kind of bent and twisted a little bit here and there, okay? So that irritation of that paper would basically represent like a first degree irritation of the medial collateral ligament. And then a second degree would be like a partial tear. So the superficial fibers of the medial collateral ligament get torn. And a third degree would be a full rupture. And so that's why sometimes it takes a few insults to completely rupture the ligament. So I hope that kind of made sense. Good. And again, we get symptoms where we have localized swelling, a lot of joint line pain right on that inside. Some people will get catching and locking in the knee as well. And that's because they've actually irritated their meniscus or maybe torn their meniscus as well. And they will complain of some instability in the knee as well. And then bursitis. There's bursa sacs all over our body, and especially in the knee, where there's a whole bunch of them. And one of the most famous ones is one that sits actually underneath your skin and between your kneecap, and it's called the housemaid's knee, because basically housemaids would be scrubbing the floors years ago and would compress that bursa sac and cause it to thicken and swell. And when the bursa sac gets irritated, it actually thickens, and you almost get like little rice bodies inside the bursa sac. I fell off my bike when I was in university because the chain broke, and it was like a dive this way, and that was back in the days when we didn't have helmets. So I put my hand out so my head wouldn't hit the pavement, and I ended up breaking my wrist. But in the process of doing that, I kind of bounced along the road, so I scraped up my whole left side, and my hip, my bursa sac on my hip, by the time I got home, was like a Nerf ball. Like it really swelled up, and then later on, within a couple of days, I could feel those little rice bodies in my big bursa sac. But icing is the best thing for bursas. So if you ever feel like you've got a swollen bursa or things are really puffy, get the ice on it right away. And then seek help for sure, because if you don't, it's going to thicken up and stiffen up and limit your function around that tendon and that muscle and the joint. And the last one is the Baker's cyst. So this is called a popliteal cyst. So basically this is swelling in the knee that's now forced the knee capsule to expand backwards, okay? And so we see this quite often in people that have problems with arthritis inside their knee, or they've torn the meniscus. That's another dead giveaway of some sort of internal derangement with their meniscus. So we often like to send those to sometimes to sports med docs if they're not getting better. Sometimes they'll drain them and that helps, and sometimes draining just causes it to swell back up again. So because you're only temporarily fixing some of the swelling, but you're not actually fixing the root cause, which is probably the arthritis or the torn meniscus. Good. There's our coffee break signal. Or slide. Do we have any questions in the chat box? Oh, Sai, you got to unmute.
Sorry. So Charlene is asking if we can give her the information through email.
Yeah, for sure. Anything that you need, we can give to you after the presentation. And Sai's the person asked for that. And Sai will probably call most of you guys back after tonight's presentation and she'll make sure you got your free report, and also offer you, like, we've got a stretching sheet that summarizes the stretching video that you'll see tonight as well. So yeah, we're happy to pass that on to you, because really for a person, when they come in with knee pain, the first thing you're going to do, we're going to prescribe as physios, is we're going to look at the range of motion. And if somebody's lacking range of motion, the quickest way to get the range of motion back is to provide some stretching exercises right away to try and increase that range of motion in the knee. And then as the process goes on, then we're usually giving some strengthening exercises for the knee, some strengthening exercises for the hip, and then we talk about balance as well. And balance is really important because as we age, balance can be a very important thing, because if you fall, the risk for fall is huge with all sorts of things that we can hurt ourselves with falls. Patients that come into the office from a bad fall often have 6 different injuries that we're treating. So it's important to really maintain your balance so you can react to changes, in the surface you're walking on, if you're going for a hike or something like that, because it's easy to have major soft tissue and bony damage like fractures and things from falls. So yeah, that's great.
There's another
Great question, Charlie.
Here
okay.
From Pat.
Okay.
Pat Kinna. She said she's asking if Baker's cyst drained several times. Will this keep returning the fluid?
Yeah, we had a hockey goalie who was kind of a middle-aged guy in the office at my Thorncliffe days a few years back at our other location, and he was seeing Dr. Bray, who's one of our top knee guys in Canada, and he did say to him, like, we can keep draining this if you want, or I should probably just scope your knee. And in the end, he drained it twice and it just kept swelling back up. And then he went in and basically scoped his knee, and he did find some partial torn meniscus tissue that was. So with the meniscus, just so you understand, there's the inner 1/3 it's what we call avascular. So if any of that tissue in there tears on the inside of that little circle of cartilage, it won't grow back. And that's the part that usually gets caught and causes locking. So the knee surgeon just kind of trims that out, knowing that it's not going to repair itself. If you have a tear in the outer 2/3, they'll actually try to stitch it back together in hopes that the blood flow to that will actually cause it to heal. And the recovery for that's a bit longer as well. But yeah, so if you're constantly draining it, I would encourage you to maybe get a second opinion if it's not getting better. Again, either see a sports med doc or maybe ask to see a knee specialist. It takes a while for those consults, but it might be worthwhile just to get a second opinion if it's not getting better. I guess my other question, Pat, would be, have you tried physiotherapy? Maybe we can chat in the Q&A after the presentation. All right, I'm going to get back into it now. Super duper. All right, so now we're going to get into the prevention side of our presentation. So how to prevent chronic knee pain? Well, walking down hills instead of running down hills is really important. So back when I used to run, I used to love hills, but I quickly realized that, man, that's really hard on the kneecap joint and the whole knee. So I used to kind of walk down the hills or walk up the hills, and I would jog kind of on the flat surfaces. And I would really try to stay away from hills. And if you're doing exercise, it's better to be on a flat surface than going up or down a hill. And then stick to paved surfaces, not rough roads or uneven pathways, because that could be hazardous to your knee's health. Stick to smooth surfaces, like a track, indoor track, maybe at your fitness center or a walking arena or Market Mall, where you can go and just walk in the mornings before the stores even open. Places where you're safe and you've got a nice firm surface that's smooth and not going to cause any problems. And then get support. So one big thing that we've done, and I've proven this with a couple of my patients that are awaiting hip and knee replacement, is we put orthotics underneath their feet, and we actually caused a little bit of a post on the inside to reduce the knock-knee sort of patterning that they're falling into. And a lot of them are very skeptical, but they were quite happy when they realized that, oh man, that does help. My knees do feel a bit better. So that's something we always like to look at as well. And then replacing your shoes. I think as a general society, we tend to hang on to our shoes too long. So, if you're walking aggressively or jogging or running, then you need to change your runners every 6 months. If you're just walking and you're not doing big distances, then at least once a year you should be changing your runners. So we got lots of great places to go buy runners. So just talk to us when you come into the clinic, and we can send you in the right direction. And then factors that may affect chronic knee pain that make it worse. So the injured, when you have bleeding within the joint and swelling, that can cause a lot of problems. So the sooner you get to that bleeding and swelling, the better. And any sprain and strain in the joint or overuse or infection is going to deteriorate the joint faster. Poor posture during physical activity is going to be bad as well. Not warming up or cooling down before activity is really important as well. And then improper stretching. So part of the rehab process is you really learn how to take care of your knees, how to stretch properly, how to exercise properly, so you're not advancing the wear and tear in your knees. So really, we're trying to prevent extra wear and tear and prolong your knees and keep your wheels working for you. The other big 4 risk factors for developing chronic knee pain is weight is number 1. When I graduated 30 years ago, they never talked about weight. But now it's like in the top 3 for factors for wearing out our hips, knees, and ankles. And what the surgeons talk a lot about is that for back surgeons, they'll talk about it. For every pound you lose, it's 1 less pound of pressure on your back. And we as physios say that to our patients every day. But for the knee, it's actually for every pound you lose on your trunk, it's 4 times less, or 4 pounds off your knee as well. So it's 4 times the torque. And that's because of the bending and the twisting that we do with our knees when we're walking and going upstairs and things like that. As we age and our joints get more experienced, we will have more wear and tear that's going to occur in them. And so what I recommend for a lot of my aging knees is to get on a bike and start swimming. So if walking's starting to hurt your knees, you got to get into more of a cycling or a swimming sort of fitness routine. And then previous injuries, again, like we mentioned before, if you have major injuries in your 20s, you're going to guaranteed to have arthritis kind of in your 50s and probably advanced compared to somebody in their 60s. And then athletic activity as well. Anytime you're doing a sport and you have poor technique, that's going to basically put extra strain on the joint. So even for golf, I usually recommend people that come in with a bad back from golf, I'm like, go back and see a golf pro, because they have eyes, they're going to get you swinging properly, and that'll actually take a lot of pressure and reduce the risk of you hurting your back again. Technique's really important for our body. And then things will help resolve knee pain. Decide to get help. And I always say it's better to seek help sooner rather than later. Doing the right exercises for sure is going to help ease your pain, and the right progression too. So we like to grade things in our physio kind of recovery programs, and then avoid sitting in awkward positions because that's going to put excessive force through the knee as well. And then doing the appropriate sort of strengthening exercises with the better posture, along with some hands-on physiotherapy that's going to get the tissue moving and really kind of guide you down the right path in your recovery. And then just the other thing we just talked about is just the hands-on stuff. And exercise prescription's great, but sometimes actually getting an experienced physio to have a look at your knee and kind of poke around and find some sore spots and do some tissue work can make a huge difference. The other thing we sometimes do with muscles is if somebody comes in with a stiff knee and they're stretching for like 2 weeks, and I find that they start to plateau with their lengthening of the muscles, we can actually do what they call IMS dry needling, and we can needle the muscle bands to actually help them neurologically relax to increase the flexibility of the joint and lengthen the tissue even faster. And yeah, knee pain is one of the top reasons why people seek help at our clinic, and especially if you're over 40. And our goal basically is to get you living the life that you deserve as quickly as possible when you come in with knee pain. And again, how to prevent chronic knee pain, pre and post exercise. Stretching is really important after to get the muscles back to their normal resting length. And so the stretching that we like to focus on is quadricep, hamstring, calf, and we'll talk about deep rotators and abductors in our hip tonight in the video as well. Trying low impact exercises, like we said, instead of tennis or running, try swimming or cycling. And try to mix low impact exercises with the high ones to give your knees a break. And then eventually you will get to the point as you age that you do need to stop running, unfortunately, and like I say, transition to biking or swimming, especially if you've got moderate to advanced sort of OA in your knees. And then lose weight. So everybody should be keeping their weight under control as we age. And the more active you get, actually, the more you can maintain the lean body mass, which is your muscles. And your muscles will drive your metabolism. So there's tons of bonuses to maintaining a regular fitness routine. And we can sort of help you with that and sort of guide you on the right exercises for your hips and knees. And again, exercises that can make you worse, anything that increases the pain around your knee, you should be doing. Just, I know that sounds like common sense, but people often come into the office and they'll say, hurts when I do this. And I'm like, well, then don't do that. And they look at me like, I waited to hear you from that. So I always kind of laugh about that. But be careful with, if you've got OA in your knee, doing or mild OA or moderate OA, avoid doing deep squats. on a repetitive basis, and stairs and high impact activities are going to create more wear and tear on your knee and wear it out faster. Yeah, and again, it just wears down the articular cartilage. And so here is the knee and hip stretching video. So get off your chair now, and here's where we put the work back in workshop. So those of you that are sitting at a desk, I want you to stand up now, and Sai's going to cue up the video. I'll press stop share.
Okay.
And she's going to play a video for the hip and knee, and then she'll jump into the testimonial and then do the draws, and we'll come back to me at the end, and I'll just talk a little bit about why choosing us and what the offer is. All right, so I'll press stop, and then I'll hand it over to you, Sai.
Okay.
There you go.
All right, and then I'm going to start my screen sharing here. All right.
Oh, yes, you can get a copy of the video, Charlene. We can send you that for sure. It's in my library of videos that I've done over the years. I'll give it to, well, actually, Sai's got it, so she can just send it to you.
Okay.
Yeah, videos really help explain stuff, and then it's always there for you as a resource too.
Okay, I'm going to start sharing now. Is it there, Blair?
Yep, I can see it.
Okay.
Blair from Nose Creek Sport Physiotherapy. So today's topic of the day is hip and knee stretches. I was just doing a virtual treatment with one of my loyal patients, and she was actually a neck patient, but she
volume
called
up.
me up for a virtual assessment.
Yep.
And she said, Blair, I've been sitting doing all
Okay.
these Zoom videos, and my hips and my lower back are starting to really bug me. So I said, well, the best thing to do is let's get going with some flexibility stretches for your hips and your knees and get you walking a little bit more if we can to decompress your back. So today we're going to go through the 5 stretches that you can do for your hips and your knees. So there's 3 for the knees and 2 for the hips, okay? We'll start in standing. So the first one's just a calf stretch. So you're going to go up against a wall, 1 foot forward, 1 back, okay? And then what you're going to do is lean forward so you get a strong stretch in your calf muscle. Can you see there? Okay, good. So there's the stretch there. Hold for 20 seconds. And again, repeat if you can 2 times if it's tight is my general rule. So that's the calf stretch. Okay, the next one is for your quadriceps. So again, your one hand on the wall, okay? You're gonna grab your foot, knees together, and you get a little bit of a pelvic tilt, so kind of tuck your tail under. That'll shoot your knee forward. Then you wanna pull the knee back, knees together, and then heel right to your butt. And you should feel a really strong stretch right in the front of your thigh and kind of the outside of your thigh. Okay, so it's your quadricep stretch for that muscle right there in the front. And then the hip flexor, because when you're sitting, your hip flexor is in a shortened position, we want to lengthen that back out as well. So it's 1 foot forward, 1 back. We're going to bend both knees, so we kind of hunker down so the back heel comes off the floor. And then again, it's pelvic tilt. So as you tilt, you should feel a bit of a stretch here. You're engaging that stretch in the front of the hip. Then you lunge forwards 2 inches. Squeeze that cheek. So stick your thumb in that cheek to make sure you're getting a good strong stretch in the front. And then thumb up. And just stretch back, so that'll kind of straighten you up a little bit. You should feel a massive stretch right in the front of that hip and here, okay? And again, you want to hold for 20 to 30 seconds. So you can do those 3 in standing. The 2 you want to do on your back are just simply laying down on your back. You're going to grab your knee, grab with the same hand, so left knee, left hand, pull towards your opposite right shoulder. So across to the hip kind of stops. Take your opposite hand, grab just above your ankle, and then pull up. And you should feel a massive stretch in the back of your hip. Because we sit, when we sit, our knees tend to go apart when the hips relax. We get really tight in the back and the sides of our hip as well, okay? So that's your stretch for the back of the hip. And then the next one is for your hamstring. So a lot of my patients have had previous back injuries, so I don't advocate bending over to kind of stretch your hamstrings that way. Lay down, support your back, and simply straighten your leg out. So you get a strong stretch in the back of the knee and then down into your hamstring. Okay, and you can even floss this out here by just going 1, 2, 3, 1, 2, 3, and do that about 10 times. Do that sort of 10 times. That puts that hamstring on stretch for a good 30 seconds. Okay, and just nice and slow like that. And you'll floss that sciatic nerve through that tight hamstring, and then you can just switch. And always make sure you do both legs. So just nice and slow, and then 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Okay, there you go. So there's 5 solid stretches that are going to loosen up those hips and knees. And try to go for a little bit of a walk if you can, so you feel like you got a bit of a sweat going before you stretch, because you're going to be more elastic and you're going to stretch better if you're heated up, okay? There you go. So let's get going on those stretches between those Zoom meetings if you can. Try to incorporate a bit of walking before the stretching. Take care. Blair Shackley from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Take care. Bye-bye.
How to kill all
in the area in 90 seconds? This simple but brilliant trick you can do tonight to eliminate all mosquitoes around you is taking America by storm. An ingenious college student in Berkeley just solved the 210 million-year-old bug problem with a device that eradicates mosquitoes from any environment.
There you go. Okay.
Yeah, it's just the YouTube. It takes off onto the next. They're all ads now. Yeah. As soon as your video finishes, the next ad comes up. Yeah. All right. Do you want to queue up Emily? So Emily is a nurse who's a loyal client who's had a few injuries and who's nice enough to do a video for us. And so we'll just queue up that and we'll play that. So I can stand here and tell you how good we are, but it's nice to actually get patients. I think that means a lot more to the people that are prospects looking at us, wondering if they should engage us or not. So go ahead, Sai.
Okay. Yeah, I'm just gonna pick Emily's video here.
Okay.
Oop. Share screen. Nope. Okay, I thought I have that ready here. You see my screen, Blair?
No, I just see you.
Okay, hold on.
Oh, that was your foot.
Okay. All right, here we go. Okay. Sorry.
That's okay. Is it still there? Did you want me to maybe keep going and then we can come back?
Yes, please.
Okay. Yeah, because we watched it before. Sai and I
Yes,
went
we
through all the
did.
IT troubleshooting. We watched the 2 videos going, okay, we know what we're doing. Yeah, not to worry. So what I'll do is
Okay.
I'll grab the screen here. I'll share screen. And then let's see if I can find I'll just go back and continue on if that's okay while you're kind of
Okay.
digging
Yeah.
up the video.
Thank you.
Alrighty. You're welcome. No problem. So just click on next one. So knees are one of our specialties. So yeah, basically turn to us if you need some expert and high quality treatments for your knees. We've got a proven track record of consistently working in our community, being very client focused since 2001, actually. Our previous clients serve as testament to our dedication to our clinical excellence. And if you have any pain that's limiting your daily activity or preventing your ability to walk normal or even rest comfortably at night, we can help. All right, so why choose us? Well, Nose Creek Sport Physiotherapy, I'm just going to move that little counter, there we go, good, is a unique clinic. We're leading the way with experienced expertise in non-surgical treatment of the knee, restoring mobility while eliminating pain. Our commitment is to restore, improve, and enhance the health and mobility and function of our clients' conditions through excellence in care, outcomes, and clinical innovation. So speaking of innovation, we've got Shockwave Therapy, which is kind of the latest addition, and it's been proven to be kind of the golden standard for plantar fasciitis. So if you have any family members that have that heel pain, send them in because it does make a huge difference for the tendonitis type stuff that we see. And we're using a lot of shoulder tendons and knee tendons as well. So here you'll find proven non-surgical treatment for the knee that will provide solutions that you're looking for. And there's the slide. I'll just keep going here for now. Oh, there you go. Can you hear it on your end?
There's no sound though, but I found Emily's
Okay,
video
yeah.
on my
Perfect. That's what I thought.
computer here.
All right. Okay. Do you want to show it now?
Yeah, if you can stop sharing this one, then I'll go
Sure.
ahead and share.
There we
Emily's
go.
video.
Go ahead. It's all
Okay.
yours.
Okay, thank you.
You're welcome.
Okay. Here we go.
There's Emily.
Hi, my name's Emily, and I've been coming here at Nose Creek Physio to see Blair for quite a few years now. I'm a registered nurse on a busy hospital unit, and many years ago my knees had gotten so bad, kneecap pain, what they call patellar femoral syndrome, had gotten so bad that I couldn't run anymore. I had so much pain even getting down on the floor to play with my kids. And I was referred by my family doctor initially. I was a little bit nervous just because I associated physio with hospital surgical recovery. Hadn't really thought of physio more for chronic pain management, but I started coming to Blair and my knees were bad enough. We did some good intensive therapy to get them on the mend, and then I learned a great many exercises really on how to take care of them and maintain the comfort level that he'd got me to. And they improved so much, I was able to start running again and actually just competed in my first triathlon, which was quite fun. And lately I've been coming to Blair just for a more acute issue when I fell and broke my arm. So I ended up back here again, working with getting my arm back to good strength so I can get back to work. It's been a lovely experience over, I think, almost a decade here. The staff do start to feel like your family as you come in and out. They know you by name and welcome you, and the scheduling has been very accommodating, especially when I work 12-hour shift works, being able to work it in and around my daily life. I have recommended people already to try it out, and I've heard some positive stuff, and I will continue in the future because I can't say enough about the whole team here at Nose Creek.
Awesome. Thanks, Sai. Do you want to get into the draws now?
Yep, for sure.
All right. Here's my favorite part. We get to create the carnival atmosphere now, Sai.
Okay,
We need like carnival music in the background, I think.
Oh. Sorry, I'm gonna go share the screen for the
Spin the wheel.
Spin the wheel. Okay. All right.
There we go.
Okay, so we're gonna start the spin the wheel now. We're gonna choose 5 winners. Can you see the wheel?
Yes.
Is everybody's name there? Let me know if your name is not there. All right. I guess I'm gonna start now. All right, Pat.
Hey,
Congratulations.
congratulations, Pat. Woo. Free massage, Pat. Are you happy?
Yeah.
Awesome.
All right. So, okay. 1. Okay, Jeannie.
Hey, congratulations, Jeannie.
3 more.
Here we go. Odds are good tonight. Better than the Lotto Max.
Sherry.
Good job, Sherry. Congratulations. Well, you guys are going to enjoy. This will be the best hour of your month with Linda, our new massage therapist. He's amazing.
2 more. All right, Joan. Perfect. Congrats.
Congratulations, Joan.
And the last one.
Here we go.
All right. Congrats, Brent.
Hey, good job, Brent. Congratulations.
All right. Now we have 5 winners. Okay, so it's Pat, Jeannie, Sherry, Joan, and Brent. Congratulations.
Awesome.
Thank you.
You're welcome. All right.
Stop share and then I share. Okay. Well, thank you very much, Sai.
You're welcome.
See if we can get back to my screen here now. There we are. And then we'll click one ahead. Here we are. Good. Oh, now I gotta switch get those pictures out of the way so I can, there we go. Okay, good. All this creative fiddling. So we're getting pretty close to the end, guys. Physiotherapy is a partnership that will work magic with both parties commit to this treatment plan. So that's what we really try to do in the first visit, is find out what's important to you and why you need us to help you with your knees. And if you give us 6 to 12 weeks, I guarantee that we'll get you back to living your best life. And that's really our goal. Because like my dad taught me, life is too short. So you got to enjoy it and stay active and be active with your family. That's really the key. And friends, of course. So thank you very much for attending tonight. So for those of you that want to continue with us, there's 2 ways to continue with us. The first one is to get a free report off our website. So you can continue to learn about knee pain. So our website is www.nosecreekphysiotherapy.com. So if you have a camera on your cell phone, you can take a picture of this slide right now if you want, or you can just write down that website address. Again, www.nosecreekphysiotherapy.com. And then on the taskbar at the top of the website, you just look under services, and then one over from that, I think, is the different body parts or conditions. I can't remember the name of the title, but you just click on it and then it goes low back pain, knee pain, shoulder. We've kind of got free reports for different body parts that we see frequently in the office. So, and then when you open to that section, there'll be a little book on the right side of that page, and you literally click on that, put in your email, and then you'll receive the free report right away. All right. And then the next way you can continue with us is the free discovery visit. So it can be done virtually in the comfort of your own home, or you can pop down to the clinic and we can have a chat with you. And if you're interested in that, you can email right away to info@nosecreekphysiotherapy.com, and one of our teammates will basically reply back to you and find a time that works conveniently for your schedule. And the other thing you can do is just give us a call, and that's our number there in the office, 403-295-8590. And Sai is always the best hostess of my workshops, and she'll usually try to go out of her way to even follow up with most of you guys. For those of you that are winners, she's going to be calling to book you in for a free massage with Linda. And for those that didn't win, we're still going to give you guys a call to offer you a free discovery visit as well, or just make sure you got the free report so you can continue learning about your knees as they continue to age. So we can all age gracefully. Good. All right, so that's the end of my slideshow. I'm going to stop my share so Sai can put us in the gallery format, and we can do our overtime gallery. There we go.
Yeah, we're in gallery.
Format. Perfect. And then we can go through the chat box now.
Yes, please.
So
we
we can.
Lots of questions there.
That's good. Yeah. So here we go. We're actually ahead of schedule. So let's get going. So can you email that information? Yeah, we talked about that already. So Charlene, Sai will email you all the stuff that you need. And yes, we can send you a copy of the video. We love sharing information because education is really the first step in learning how to help yourself. And then again, she asked, would it be helpful? Memory? Yeah, my memory isn't as good. I know the feeling, Charlene. My memory isn't as good as it used to be either. And then let's see here. Yeah, Pat had asked about the cyst of her knee and draining it. And it keeps returning and filling with that fluid. So so that could be, Pat, could be the osteoarthritis in your knee. So that's something that, you know, if your doctor has done an x-ray, we'd definitely be looking at your x-ray, and we'd look at you physically during an exam to kind of see where you're at with that stage of wear and tear. And so that might not be something we can fix. That might be something we need to manage. If it's really severe osteoarthritis, then you're probably going to have some swelling that might not go away. But maybe, Pat, you're unmuted right now, so maybe just fill me in a little bit about your knees. Like, are they really stiffening up on you and becoming really painful, or what's kind of your current symptoms in your knees?
They're vary from day to day. I can't do stairs, but I haven't been able to do stairs forever.
Okay.
I've been to your clinic. Financially, it's tough for me. I don't have coverage.
Oh, okay.
I was working on my knees, and I got exercises and so on. But the idea was I was trying to avoid getting knee replacements. I'm still on the long list, or the long waiting.
Yeah.
It's supposed to be June now. It's going to be midwinter, they said, and they won't get much idea. So I don't want to get my knees replaced, like if I can avoid it. But I don't know if I can manage the cost, you know. So I would like to talk about the orthotics though, and to find out if I could get a suggestion of what kind of runners to get. Because
Sure.
I know my runners are old and my orthotics are old. So you guys do the whole thing with the orthotics?
Yes.
You do the forms and everything?
Yeah.
That have
So
to be a requisition from the doctor, or can I straight go to you guys?
yeah. So to get reimbursed, you typically need a medical doctor's referral. So the insurance company, or do you have benefits, or are you retired now and you're done? Yeah. So so if you
out of my pocket.
Yeah, exactly. So a lot of my retired folks that don't have benefits, they just come and we just do the orthotics for them. They just pay. They don't get reimbursed because they don't have benefits, but they're happy to get them because
So
we
what's
can.
approximately $500 or more?
Yeah, so they're $550, and for you, because you attended the workshop tonight, I think we could probably do $100 off just to help you, because I know you're retired, and I have no problem with that. And we can, like I say, with that one lady, she's actually awaiting bilateral hip replacements, and she'll probably have surgery this fall and she contacted me, and I know, don't blame the surgeons. It's because of COVID. What happened was their wait list just got pushed back because they kept canceling all their surgeries. So so just be patient. You'll get there eventually. But yeah, in the meantime and in between time, that's what we did with Carol. Is we put some orthotics under her feet, and she was really skeptical, but she's like, I wouldn't have believed it until I tried it. And she said, it actually does make a difference in my knee pain, and a little bit in her hip too, because if you internally rotate your hip, if you kind of point your toe in, that puts more pressure on your hip. And if you can stop that extra pronation that occurs that causes your hip and your knee to kind of go in, then that's going to reduce that strain on that inside part of your knee and your hip. So they can make a mechanical difference. But the exercises you were given, I would just encourage you to be regular on those if you can. And again, with arthritis, if you're waiting a knee replacement, then you've got severe, probably almost like bone on bone type situation. So it's probably biking and swimming would be, again, the two exercises I'd recommend for you. I haven't myself got in the pool yet because I'm still a bit scared of COVID, but hopefully within the next couple of months, we'll be safe to start venturing back to the pool. And balance issues you'd mentioned as well. That doesn't surprise me. As our knee wears out, what happens is you're getting all these pain messages that are being sent up to your brain because of all the painful surfaces that you have that are kind of worn out in your knee. And so your body is constantly trying to adjust to find a comfortable spot. When we do the orthotic analysis, it's amazing. We see in people that have painful feet, it's supposed to be a natural, just kind of little whip that occurs with weight bearing through our foot. And what happens is we get all these little kind of like deviations in that natural little curved response we should normally have when we hit the plate, and kind of go heel toe as we push off. And what that is actually just the reflex of the brain going ouch, and it's causing your foot muscles and your nerves to twitch, which causes a change in the weight bearing of your foot. And so what's really neat about that is when you look at that, people normally should kind of hit their heel, go on the outside of their foot, and then they should go 5, 4, 3, 2, 1, like across your foot from the fifth to the first toe, which is your big toe. And then we push off the big toe. That's the last thing that leaves as we sort of propel ourselves forwards. And a lot of these people don't go 5, 4, 3, 2, 1. They go 3, 4, 3, 5. And then they kind of wiggle back and forth, and it's what they call aberrant movements that we're trying to correct to take pressure off the foot as well as the knee and the hip further up. So that's
my orthotics are old, and I'm getting knock-kneed, so maybe that could help.
Yeah, so we can post them up. Like we'll talk to the lab, and what they do is it's quite subtle. It's not a lot. We just do a little bit of a post to lift the inside of that arch and just offload those knees a little bit. So I'd be happy to do that for you for sure. Thanks. And then I know you want to avoid a knee replacement, but I had to have my right hip resurfaced about 4 years ago. And when I first got news that I had to have that done, I was like, I don't want to do that. Like I was like, but I didn't really have a choice. Once you're a bone on bone, your quality of life, as you've probably seen in the last few years, starts to really drop down. The surgery is a major surgery, but when you recover from the surgery, your pain is, in most cases, is gone. And so that's why people that have the joint replacements, when you talk to them, they're just like, oh yeah, my life is way better now because I've got less pain, I've got more range of motion, and I'm back to doing the things I love to doing, whether it's walking the dog or going up and down stairs or, and so I know it's a big step for you, but if you've got the health and you're a healthy person, then I think you should probably fall through with that recommendation.
It's both knees, but I'm 81 now, and I waited 16 months already, and now I don't want to do it. But I would like to have, could I have an appointment with you to talk about that stuff?
Sure. Yeah.
I'm sorry I'm taking up so much time, guys. But,
Yeah.
you know, just to kind of tell me exactly what you think about that. And
For sure. Yeah.
And there are x-rays and they would be able to be found on the computer. I had what's done recently, so you would be able to.
Okay. Well, Sai, can you arrange a discovery visit with Pat and me? Like, I could even do it tomorrow if you want, Pat. I have a couple cancellations tomorrow, so if you want to pop in, we can have a look at that tomorrow if you like. Not a problem. We're here to help. Okay, so I'm going to move on to the next question.
Thank you.
Hey, you're very welcome, Pat. Not a problem. If you have arthritis issues in your knee, and the knee sleeve will help create compression, is that right? Okay, so yes, Charlene, the compression you get from a neoprene sleeve is wonderful, actually. And then people that have put the neoprene sleeves on will often say, wow, that actually feels good. Because what it's doing is compressing the knee, and it's actually warming your knee because it's kind of holding that heat within the knee. And so most of my patients that wear the sleeves love the sleeves. They don't give you any side-to-side kind of stability like maybe a hinge brace might, but I do encourage people, if it makes your knee feel better, then wear it for sure. And then you sort of said, because of a car accident, I have no hip rotation on my right side. Could you help with that? For sure. So we basically are body mechanics. And so today we're just talking about the knee, but the knee is directly related to the hip. And so a lot of our patients that come in with knee pain often have hip pathology that's driving extra pressure into their knee. And so when I do a knee assessment, I always say, just excuse me for a second, do you mind if I look at your hip? And people always look at me like, oh, no, it's my knee that's wrong. What are you looking at my hip for? And often I'll show them, like, compare side to side, and I'll show them that there's a loss in range of motion on your right one due to flexibility or maybe some arthritis or some other changes in the hip that's driving more pressure down into your knee. And then some of these people will come in and say, yeah, my feet have gotten kind of sore the last couple of years too. And the feet are like the garbage cans for the leg kinetically. So when you look at the reduction range of motion in your hip and your knee, your poor foot still has to compensate and propel your body forwards on those stiff knees and hips. So often people will come in with foot pain as well. So what Chris and I have learned over the years is you end up treating the whole leg. You can't just treat the knee. You end up hitting the knee, the hip, and then you kind of mobilize the foot, and then you get them going on some foot exercises. And we always do balance with all our patients because that's really like the icing on the cake to get your function back. So for sure, anybody in our clinic would definitely look at your hip for sure, Charlene. And then Sherry had asked, I was told to walk on grass as that has a bit more give. Is that bad for your knees? No, that's not bad for your knees as long as it's level and pretty smooth. If you're kind of in grassy field like that, then I would say that jarring motion is going to create more stress on your knees. But yeah, your doctor might have told you that instead of walking on the concrete, maybe walk on the grass if you're getting exercise. And for sure, that's going to be softer and have a little bit more absorption of the shock versus like walking on concrete, but just make sure it's a fairly even surface if you can, because if there's potholes, you're at risk of aggravating your knees for sure. Was told to do weight-bearing exercises. Yes, for sure. Weight-bearing exercises will fire more nerves, which fires more muscles. So like doing a simple 1/3 squat can sometimes be more effective than sitting and doing a whole bunch of knee extensions in the gym. Knee extensions actually tend to give people patellofemoral pain. So we tend to train people away from that if we can. But you will get to a point in life, like with Pat, where the 1/3 squat might be really painful now. So in Pat's case, open chain exercises might be more comfortable for her now. And that's why usually swimming feels good, because the knee is lightly moving against some resistance, and the buoyancy kind of takes the weight off the joint as well. And then Pat asked again about, can I avoid replacement by doing a physio program? For sure. The stronger and fitter you are, the less pressure you put on the knee, essentially. And so good surgeons now will tell you, okay, you're going to have surgery in like 3-4 months. I actually want you to go to physio now and get your body fit so you can recover quicker afterwards. I've had a couple of shoulder surgeons send me patients that are already scheduled for surgery in like 3 to 4 months. And they're like, go to rehab with Blair and get your shoulder as fit as you can so that coming out of the surgery, you're going to recover twice as fast. One of those guys is actually another video testimonial, Mark, who's a WestJet pilot. He had a shoulder rotator cuff tear. Anyway, so he was an interesting guy to work with. And then Charlene asked again, can we get a copy of the video? Yes, Sai will send you a copy of that. And she said, thank you, you're very welcome. And can you help with hip rotation? Yeah, we talked about that. And the video, yeah, thanks, I'm glad you enjoyed the video. And then type of runners. Yes, we can definitely help you with footwear when you come in, Pat. So we've actually got, we can even recommend the type of shoe and then even the store to go to get that shoe. So we sort of have three main providers for stores that we recommend in town that have high quality shoes. A lot of those stores make orthotics as well. So they kind of get what we're trying to achieve with a lot of our worn out feet and to try to give people happy feet again. And those of you that do have benefit plans, a doctor's referral is required for most reimbursements of benefits. And I understand you have lots of experience with knees. What about hips or Achilles issues? Yes, so we have lots of experience with hips as well. And hips are huge joints that really propel us and are very important for our knees as well. When our hips start to stiffen up, then we put more pressure on our knees. So part of the rehab is, again, doing some strengthening for your hip as well. And Achilles issues, yes, that's the most common tendon that we have problems with as we age. The Achilles tendon is a very important tendon, obviously, because again, it's the one that helps propel us forward in our gait, but it's easily broken down. And sometimes it sneaks up on us because it's a pretty big tendon. For me, back when I used to run, I didn't even realize I had Achilles tendonitis until one night I kind of ran up the stairs and I felt a sharp pain in my tendon. I thought, what the heck? And I looked down and there was my Achilles. It was twice the size of my other one. I thought, holy crap, I didn't even feel it coming on. It just slowly kind of came up. And that's what happens. You get small fraying tears, and you sort of get like 100 micro tears, and that adds up to one macro tear, which actually registers in your brain, and you realize something's wrong. So if you've got Achilles tendonitis and a swollen tendon, you've probably had it for 3 to 4 months before you've even noticed it. And so, yes, we can help you with that as well. And the big thing is, again, like we talked about in the presentation, doing the heel drops once your tendon is comfortable enough to load it to cause it to repair itself. And again, that should be part of your fitness program for the rest of your life once you've done that. And when you're doing the rehab, it's done daily. And then once you're done the rehab and you graduate from your active care, then we encourage people to do it maybe 2 to 3 times a week for the rest of their life, just to keep the tendon healthy and strong. And then Joan said, yippee, thanks so much. All right, well, thanks. I'm glad you're enjoying it, Joan. And then Charlene, can you answer questions? Yes, so we can answer questions. So if you want, what I'll do is I'll finish these chat box questions, and then Charlene, if you have any more questions, we can just do like an open mic session. And then Sherry asked how often our sessions are. Okay, so how often are sessions in that 6 to 12 week frame period? Okay, so that's referring to I think the tendinosis comment or the slide we had there. So in Nose Creek, what we've developed over the years is we front load you in your frequency of visits at the start. And the main reason my philosophy is for that is I want to teach you as much as I can in that first month, because once you've got that and you're starting to get better, then you just got to go do it. And then we just monitor you through that recovery. And with Achilles tendinosis, typically I'm seeing people twice a week for the first couple weeks, and then once a week for a couple weeks, and then I do a 4-week reevaluation. If everything's going as planned and you're doing well, then you continue doing your exercise program, and I treat you every 2 weeks. And then we reevaluate 8 weeks. And if you're feeling great, you're done. If you're not quite there, then it's, again, we probably follow up for a couple weeks in that 3rd month as well. And sometimes I'll even leave people for another month, and I'll see you in a month type thing, just to make sure, because the tendinosis, especially in the Achilles, can take, again, 3 to 4 months of just working with us. And then once you're to the point where you're stable, then you'll still need to work on it for another sort of 3 to 4 months. So great question. And so most of my patients, I see about 8 times on average. If you're wondering too, like how many times do we see somebody for a really bad Achilles tendonitis or shoulder rotator cuff tendonitis? Can I get answers to the chat questions? Okay, we can share a recording of the video with you. So Sai can send you the recording of the video tonight, because we're still recording the video, right, Sai? Yeah, so
yes,
we'll send you a copy.
Recording.
Yeah. So there we go. So yeah, I saw the little recording button in the corner. So we can, Pat, send you a recording of the video, and you can just watch the video again at your own leisure. And then Sherry asked, how much do physio sessions cost? So the assessment at Nose Creek is $180, and for follow-up visits is $150. And again, most people that have benefits can get reimbursement for that. Your treatment plan will always exceed your benefit plan as well. And for those of you that are retired, there is a discount as well. I can't remember what it is off the top of my head, but there is a discount.
For 155 for assessment and treatment for seniors 60 years old above, and then 140 for the follow-up.
Yeah, so it's a bit of a discount there to recognize that and support you as you retired. And then Charlene Luker asked, walking like a penguin, is that a knee issue? Walking like a penguin is actually a hip issue. Great question, Charlene. So if you're walking down the hallway and you're kind of doing this, that's your hip that's causing that. I had that before surgery. I was walking like the penguin on Batman for sure. And we even joke about that as physios. You can tell, like if you're sitting in a mall and people are walking by, you can tell just by looking at people kind of which joint it is. Yeah, definitely side to side is going to be more hip. Wouldn't you say that, Chris? Yeah, knees can give you a variety of different gait abnormalities. So we won't have enough time to get into that tonight, but and then would vibration platform be damaging? That's a great question. And to be honest with you, to be humble, I don't know the answer to that. There is a lot of research going on with osteoporosis and vibration to try and stimulate bones right now. And vibration mechanically does stimulate nerves. And so that's why in the clinic, well, sometimes if somebody's in a hurry and I immobilize or manipulate their back and they don't have time to go on the IFC, which is like a pain modality and some heat, then I'll say, well, listen, let me at least shake you up a little bit. And so I take a massaging vibrator up and down their spine for 2 or 3 minutes. And that often makes them feel better because it's vibrating and stimulating all the mechanoreceptors in their spine. So I do think there's more to vibration than we know. And I'm sure research in the next few years is going to prove that. So I almost think the vibration, if anything, is going to actually help stimulate circulation and help the bone more than damage the bone, to be honest. As long as it's a moderate level, it's not like excessive kind of vibration. Good. That completes the chat box. So I'm going to close my chat box now. And then who's the one that we're going to open up for, Sai? Was it, I think it was Charlene. Charlene, do you have any more questions?
No, what I'd like to do is set up a discovery.
Okay, sure.
Discovery visit. That would be great.
Yeah. Okay, so then you can just talk to Sai, and then she can set that up for us as well. And you can be with myself or Chris. I'm only there 3 mornings a week, and Chris is just coming in July. So if you want to get started right away, I can definitely see you. Chris will be starting probably in the month of July, as she's just coming back from some medical leave. So I'm really excited to get her back again.
How easy is it to get in to see you?
Well, actually, like I say, I have a couple cancellations tomorrow. So if you're really motivated, I could see you guys tomorrow for some of you. If not, then I'm in the office Monday, Tuesday, Thursdays. And yeah, we can talk about costs and all that kind of stuff and what a treatment plan might look like to definitely get you moving better and just give you the stuff that's going to support you and help you. I think it's really important to, like I send people to nutritionists every once in a while too, and I tell them the nutritionist will basically get you off the food that's fighting your system and give you food that's going to help you and actually make you feel fuller and be more nutritious, and you'll actually lose weight just because you're eating better. Not even talking about getting more active. So I think it's important, like we're like mechanics of the body. We can teach you what are bad things for your knees and what are good things for your knees, and same thing with the hips, the ankles, and the feet. So we'll definitely have a look at you for sure. The discovery visit, just so you can understand, is about 15 to 20 minutes. We have 4 simple questions that we give to you. Sometimes the girls will even send you the questions in advance, and we usually like that because that just saves us a bit of time. We just put it on a clipboard, and then we just have a sit with you at one of the cubicles, and we just go through a little bit of your history, and then we kind of, just by listening to your history, we can almost know what's wrong with you, and then we'll give you one thing to take away, and we call that your little win. And usually it's just a stretch that we want you to test your injured knee or hip with. And then we'll say, and let's book a full assessment in a couple of days, and then we'll do a thorough physical exam of that hip or knee, and then we can know exactly where we're at, and we can get started on your recovery. But it's just a good way to kind of get to know you, to see if there's something we can help you with for sure. Some of our discovery visits have resulted in a recommendation to go see your family doctor as well, because every once in a while we'll get people that haven't seen their family doctor in a few years, and they'll come in with what presents like a rheumatoid arthritic sort of knee, and we're like, wow, I think you need to go get some blood work done. That's happened a couple of times to me. And so we'll get the doctor involved in the care of the knee as well. And quite often we'll see some of that stuff pop up. And then the doctors are really pleased that we identified that and that we're doing some work with them. And we like working closely with your family doctors and getting them to help us with sort of what we call medical clarification, x-rays, ultrasounds, and all that kind of stuff to help us manage your pain.
Perfect. Thank you.
Yeah, you're very welcome. Does anybody else have any other questions? No? All right. Well, it's 8:15. It's time for Blair to sign off. I'm going to go see what's going on in that hockey game now tonight. And I have to call my mother back. She called right before the workshop. I'm like, Mom, I got to go to workshop. All right.
Thank you.
You're very welcome, guys. And hopefully I'll see some of you in the clinic in the next week or two. And thanks for all the help, Si. I really appreciate you being our hostess with the mostest.